All right. Hello, everyone. Thank you for joining us today to hear from your fellow students. This is our annual student symposium for the USC Institute on Inequalities and Global Health. We're excited to hear from our speakers today who are going to share about their experiences. And before we do that, I'm going to give you guys a little bit of an overview about our institute and our education opportunities. And then we will start to hear from our student presenters. So a little bit about our Institute on Inequalities and Global Health. For those of you who don't know, we're a university-wide center of excellence in global health research, education, and policy engagement. And we work with partners both across USC and outside of the university all around the world to expand the evidence base about what works and what doesn't. What we call research, training the next generation of leaders through education opportunities, and informing public policy. So working with policy partners all around the world to advance public policy based on understanding what works and what doesn't in the research space. And next, I'll give you an overview of the many education opportunities that are offered through the Institute. So for those of you interested in global health, you may be aware, some of you may come from these programs. We have both undergraduate and graduate degrees related to global health. So at the undergraduate level, there's a major in global health, as well as at the graduate level, we have a Master of Public Health program, both online and on campus. That includes a specialization in global health. We also have a Master's in Global Medicine program. There's plenty of other related majors and minors related to global health and public health. So I encourage you to consider those if this is something that interests you. We also, through the Institute, offer some graduate courses abroad. So we have a course on global health governance and policy, where we take students to Geneva every year, as well as a course on climate change and public health, where we take students to Costa Rica every year. We also offer courses in collaboration with the Association of Pacific Rim Universities. And what that means is it's one of my colleagues, Dr. Melissa Withers, and I have taught courses in global health leadership or global health ethics with 4 to 5 other universities around the world. We all sign on simultaneously and have an opportunity to hear from our colleagues and students from around the world. So it's a really interesting model of taking classes kind of in a global health context. We also have an annual global health case competition, which many of you have participated in, and we look forward to welcoming you to participate in this year. That's usually held in February, and stay tuned for more information on the dates and announcements for that. We offer several research fellowships, as well as internships, such as the Sustainable Development Goals Leadership Academy. We help students, MPH students, obtain practicums around the world for those who are interested in working in global health. And we have several student research opportunities, whether you sign up as a 490 or a 590. We have volunteer research opportunities, paid student research opportunities. You're going to have a chance to hear from a few of our students who have participated in those today. We also have a student advisory council, and this is an opportunity for students across the university to get involved with the Institute and shape its programming and the agenda. We really value the feedback of our students, so that's an excellent venue for those of you who are interested to give us feedback and to give us guidance on what you guys would like to see. We also offer a speaker series where we have fantastic speakers from around the world, practitioners and experts in global health who give amazing talks. I encourage you to sign up for those, view the recordings if you can't make it, but you really get to hear from a wide variety of experts in this space. And we also participate in several conferences, including that Los Angeles Global Health Conference, where we convene a student team to work with the UCLA folks to convene this conference together. And it's a student-run conference, and we support the students to put on the conference together. So as you can see, we have plenty of education opportunities that we offer through the Institute for students to get more involved in global health outside of the classroom, inside of the classroom, in different countries, and plenty of forums. So I'm going to pause there and go ahead and turn it over to our first speaker. This symposium is really about hearing from the students themselves more so than me about kind of what their experiences are in these different aspects. So you're going to hear from a variety of students today about the different roles and experiences they've had with the Institute. I'm going to go ahead and turn it over to Lily now.
Hi, everybody. My name is Lily Guo. My pronouns are she, her, and I am a student researcher with the Institute on Inequalities and Global Health. And I'm also a global health major graduating in a month, which is kind of crazy. But I've been with the Institute for 2 years now. I started in summer of 2020. My relationship with the Institute started with my first global health class with Dr. Ferguson, HP 270. I'm sure a lot of you. Oh, yay. Okay. I'm sure a lot of you have taken that class if you're global health majors. But I basically reached out to her the summer after I took her class. I was like very lost, confused about next steps, and she really helped mentor me and still mentors me to this day, which is really, really very grateful for that. But basically my relationship with the Institute started with that. And then I ended up doing some research with them through this program called URAP. Next slide, please. So this is the Undergraduate Research Associates program. I'm not like a URAP person, but I definitely recommend it to everyone to go check it out. It provides financial support for students and faculty to do research together, and you get a stipend for each period. So I got a stipend for my summer period, and then the 2 semesters that I worked with the Institute afterwards. But yeah, it's a really awesome way to build connections with faculty and advance your research skills. So for example, I learned with the Institute and through URAP to do literature reviews and to do qualitative coding with NVivo to figure out how you might start and finish a research manuscript. So I really recommend it. Check it out. Next slide, please. Awesome. So the first project that I did with the Institute was this WHO Global Policy Survey. It was on sexual, reproductive, maternal, neonatal, child, adolescent health, so quite a handful. And so basically what this survey did was it sent out to, I think, 99 or over 100 countries, asked them a lot of questions about all of those different types of health. They sent back answers as well as documents, and me, along with another team of student researchers, would validate these. So we would say, okay, what did the country say to this question? And does the document that they uploaded corroborate that answer? So as you can see, we ran this cool little analysis about questions that, didn't get answered frequently. They didn't upload the right documents a lot of the times. And then we actually ended up making a report to send to the WHO to improve this global policy survey, which was really, really awesome. Next slide, please. For the global policy survey, that was through URAP too. So what you do after URAP is you create like a final product. Could you just go back one slide, please, or a couple slides maybe? Yeah, perfect. Thank you. So this was a page of the product that I produced. You can write like a written thing. You can do I did more of like a infographic brochure type thing. But it was a really nice way to reflect on all of my experiences and put them into an actual document that could be shared and used and all of that. So yeah, next slide, please. And then I also worked on this UNFPA report, UN Population Fund. This was like a huge systematic literature review. We ended up reviewing like hundreds of articles, ended up including quite a few. So basically this was looking at, for sexual and reproductive health and rights. That's what that SRHR, what is that thing called? SRHR means. But basically we were looking at, if there is a law having to do with SRHR, why aren't people on the ground receiving services or enjoying those rights, right? There are a lot of barriers that go from one end to the next. And so we looked at some legal barriers, some structural barriers, and societal barriers. And then on top of all of that, we got to do some country case studies. So we did Malawi, I think Colombia, Uruguay, and I think Zambia, if I'm correct. And I got to sit in on some interviews that Dr. Ferguson conducted with key stakeholders from Malawi about sexual and reproductive health, which was just incredible to see a different country, a completely different country from the one that I was familiar with, and seeing the different ways that laws get interpreted, how they get stopped, what protective factors exist within a different culture. So yeah, next slide, please. And then I'm not going to talk about this so much because I know Maylise and Asna, my awesome peers, are going to talk about it. But I also worked on the Health and Human Rights History Project, oral history project, and basically we conducted like 33-hour-long interviews, and the highlights are all available online. But yeah, we got to talk to some leaders in the health and human rights field, and this was super insightful. Next slide. So what is next for me? Well, I am graduating in December, as I said. So I am looking to do some work in providing harm reduction services or the like to some key populations in LA. Actually was totally inspired by the Health and Human Rights Oral History Project and talking to harm reductionists. So I'm grateful for the Institute for bringing me into contact with those people. And then in graduate school, we shall see, but my end goal is teaching and mentorship, and a big part of that were the mentors that I got through the Institute. So yeah, next slide. So this is a lot of text, you can read it. But basically the Institute has just really provided me with a much more rounder and fuller education than one that I would have gotten if I had just gone to all my classes at USC. I learned so much more about research opportunities and skills, like I said, but also how to interact with people, how to, create relationships in an academic and professional setting. And then also got to interact with awesome people that like some of the people that are going to talk today, who are just passionate about the stuff that I'm passionate about. And it's just a really cool thing to be surrounded by people that are as passionate about those things as you are. So yeah, that is my presentation, but I have my email on the slide if anyone wants to reach out with any questions. But I really appreciate the Institute, and yeah, can't wait to hear the other people's presentations. Thank you so much.
Thanks so much, Lily, for that beautiful and concise presentation. Next, I'm going to ask Maylise and Asna to share with us. They're going to talk about the Health and Human Rights Oral History Project that Lily was just touching on. So take it away, Maylise and Asna.
All right, but we can go ahead and get started. Hi, everyone. Okay. I'm Asna. I am a junior at USC studying biomedical engineering with a minor in resistance to genocide. And Maylise.
Hi, everyone. Okay, there you go. Hi, everyone. My name is Maylise Pasturk. I am a second-year medical student at the Keck School of Medicine. And we're going to spend the next, about 15 minutes talking to you about our experiences as student interviewers for the Health and Human Rights Oral History Project. Next slide.
So before we get into our personal experiences, we're going to be going over the purpose of our project and then identifying the needs and approaches that we took. Next slide, please. So the needs that we identified were that we need to encourage human rights discourse in the health context specifically. But in order to do this, we wanted to leverage over oral history and storytelling specifically in public health research, and then connect the public health field for a global and holistic understanding. So the approaches that we identified were that we wanted to pose critical questions and then record the responses to those questions in the form of stories, and then finally diversify the voices that we can see all around the world.
Okay, so a little bit more about the project. So it's the world's first dedicated library to oral histories of the modern health and human rights movement. And like Asna mentioned, it fills a critical gap in the history of public health by providing an inside view to decisions, discussions, and dynamics behind some of the most impactful health and rights interventions that we've seen in the past several decades. The project is supported by the Open Society Foundation, and the oral histories feature staff and grantees from the OSF's public health program, which for 30 years served regions across the world across many different issues. And just to mention, it wasn't only OSF grantees and staff members, but we also had some scene setting interviews where other key figures in the field, like this institute's very own Sophia Greskin, were interviewed to kind of help set the scene to see, what was going on in the field outside of OSF's contributions. Okay, next slide. So just a little bit more about what we did and our responsibilities. So there were 3 of us. Shout out to Lily. I know she mentioned a little bit earlier, but we each were tasked with to conduct 10 oral history interviews. And the first thing that we did for every oral history was conduct background research. So we were assigned an interviewee who focused on a specific issue, like maybe access to medicine, HIV, harm reduction, engagement with the Global Fund to fight AIDS, TB, and malaria, more that I can go on to talk about for a long time. But so we were tasked with, researching that issue as well as kind of the region they were working in. And, we'd go through reports, articles, interviews they may have had. And we also got a chance to speak with them for an hour before the official oral history, just to kind of, try out some questions, elicit some stories to see if there's anything, we want to delve deeper into. Okay, next slide. And then the next thing we did after we feel like we've had enough context around the issue and the region that our interviewee worked in, we went to work on developing a questionnaire. And, this is a 3-hour oral history. So, we have about 30 to 50 questions that we try to generate. And just some things that we think about when we develop these questions is we're really trying to optimize for stories. And so, reassuring the interviewee that there are no right or wrong answers, and kind of letting them know that the purpose is to have them express themselves and maybe surface some experiences or memories that they may lay more dormant. And in terms of the questions we would ask, we were looking for emotional moments. We asked people, when were you the most surprised? We asked for superlatives, extremes, tell me about the best or the worst moments. What was tough? What was challenging? And these really sparked a lot in our interviewees and kind of helped them go off and tell beautiful stories. Yeah, okay, next slide. So, after we did the background research, we developed the questionnaires, then we actually sat down with the interviewees for the 3-hour oral history. And this was over Zoom. With a 10-minute break at the halfway point. But our responsibility at this point was really to just sit back and listen, non-verbally encourage interviewees to fully tell their story. And kind of once we could see they were done, then it was on us to either probe deeper, ask, what happened next, or, decide to move on to another question or another theme. I guess something I didn't mention with the questionnaires, not only did we try to optimize the questions for stories, but also the entire structure, trying to figure out a flow that really kind of helped move a plot forward of like, a beginning, a middle, and kind of a current state of their work. And that was also something we were doing in the interview as well, trying to pick questions that really helped move that plot forward. Okay, and then next slide. And then, once oral history is over, a recording is generated and a transcript is made from that recording. And then last step is that we got the chance to communicate with the interviewees over email after the interview, to exchange edits over the transcript, make sure that the grammar, the language was accurate. And if there's anything that the interviewee wanted to exclude for whatever reason, maybe sensitive information, they had the chance to exclude that from the archive. Okay.
Awesome. Next slide, please. And now we'll go into some of the notable experiences that we've had. So I personally, when I reflect, I think of 3 main things that I've garnered from my 10 interviews. The first being listening. Next slide, please. So here's an interview excerpt from Pavlo, who is from Ukraine, and he was a former deputy minister of health in Ukraine. And he's talking about the importance of listening to those inside Ukraine when we're talking about the war. So paradigms are constantly transforming and changing, and you don't see that from the outside. You use old set of beliefs, set of coordinates, and how you perceive the world. But inside, you see new things and different things that we can talk about. So it's important to listen to them. Next, we have decolonization. The first quote that I have is from Sisonke, who is from Southern Africa, and she was OSF staff in the HIV/AIDS department. But she's talking about how in the Southern African perspective, you must insist that programs that are based from New York or London are not the only ones sitting at global tables, because the global gets owned by the global North. And it's important that others participate in those processes, not as only recipients, but as knowers and creators of information. Next slide, please. And the second quote I have is from Raluca, who's also OSF staff, but she's from Romania. And she's talking about a story how when she was at the table and she was asking for data about mental health financing, she found out that the data was all from Western Europe, even though mental health financing, the workshop was concerning Africa. So she's talking about how there's this very Western understanding to how to fix or address issues, and that we take that recipe and disseminate all over the world, even though that might not be the most accurate thing to do. Next slide, please. The last is agency, and Maja Sajdovic is also OSF staff from Romania, and she's talking about how even though you have the same issues, when you think about approach, community, and context, it shapes the same issue in a way that you almost cannot recognize it. So it's important to have the community member in the front so that they can own and lead their own initiatives. Next slide, please. And my second quote is from Sisonke, who is from Southern Africa, once again, but she's talking about a participant who says, as grandmothers who are taking care of children, what would really be good is if we get money, because then we won't just be receiving all these shoes from donations. I would like to be able to choose what I'm going to get for the kids because I know what the kids need. And shoes is not the thing they need all the time. So we have this notion of African agency and how people will have to define what they wanted, and we would have to listen. So again, all three of these things are very interconnected: listening, decolonization, and agency. But I would say that these are the three main things that I kind of took away from my experiences with 10 interviews. But I'll pass it off to Mylise.
Yeah, okay. So in the interest of time, I wanted to play these videos for you guys. These are kind of two interviews that really stood out to me the most. Michelle Pierre-Louis, she's the former Prime Minister of Haiti and also the president of FOCAL, which is the OSF's National Foundation in Haiti. And in this highlight, she tells the story of how there are these farmers from this distant village that walked for days to come and see her specifically. And they'd saved for years in order to ask Michelle if she can build them a health center for their village. And obviously, me paraphrasing it doesn't do the moment justice. So I encourage you guys to go check out the highlights. But Michelle was my second interview, and hers really is the one that hooked me deeper into the project. So Sophia Greskin was my 9th interview, and the reason why hers stood out to me the most, kind of in a very similar way to Michelle's, I guess when it comes down to it, I saw who I wanted to be in these women, and I saw their deep respect for humanity, their love for humanity and the work that they did. And Sophia, I guess her being the 9th interview was a really full circle moment for me. We started off our training by reading her article, The History of Health and Human Rights, to then, journey through the oral history, meeting all these people across the world, getting to know their stories, to then, kind of coming back to Sophia, who, her work really laid the foundation to this movement in a lot of ways. And it was just so incredibly rewarding. And yeah, I think I'll end it there. I wish I could spend more time talking about it, but I think we're a little bit over.
I'll just end off by saying that we learned so many lessons through this interview process, and it was educational and it was inspirational. But overall, I think the biggest takeaway we had was that the importance of storytelling is so important, and that does not kind of detract from the idea that we can use storytelling in public health research, and it is a very valuable form of research. But yeah, I hope we were able to provide a little bit of insight into the HHROHP, but thank you so much for listening.
Thank you both so much for such an excellent presentation. It sounds super interesting, and we're looking forward to check out the interviews much more. Thank you for sharing your experience. Now we're gonna switch a little bit from the student research projects to some of the education opportunities. So Mihir and Manushree are going to present about their experience in the global health case competition. Mihir, Manushree, take it away.
Thank you so much, Dr. Kumar. Mihir and I are so happy to be here. We'll introduce ourselves in just a second, but like Dr. Kumar was saying, we are going to be presenting on the case competition, which both of us had the privilege to do together for 3 years while we were at USC. So for those who might not be familiar with the case competition, it's kind of a 2-week long period where you get a prompt or a case that surrounds a global or international health challenge. And with that context, you're kind of allowed to, and given the creative freedom to come up with a really novel solution that can span different kind of holistic areas or topics, even different regions, really get to dive into this with people who span different creative outlets on your team as well. And so that's a super holistic overview, but this kind of happens in February time, a 2-week period, and then you get to compete virtually. And then the final team who makes it to the top at the USC competition gets to go to the international case competition, which is even more of a delight. So yeah, we had the privilege of doing that for 3 years, and I'll hand it off to Mihir so you can talk a bit more about what we've done so far.
Yeah, awesome. So as Manushree said, we'll quickly introduce ourselves here. So hi, I'm Mihir. I studied human bio and econ at USC. I graduated this past May. I'm currently working as an economic consultant, and I'm hoping to apply to med school this upcoming June.
And I'll introduce myself really quickly too. My name is Manushree. I also graduated this past May in 2022. And I was a public policy major at USC, and now I am working as a paralegal in DC.
Awesome, cool. So you guys can read these like long titles. I'm just going to briefly describe what we worked on. But for the past 3 years, we were able to do these case competitions, as Manushree said. The first year was basically a competition about treating obstetric fistula in a cost-efficient but also really comprehensive, holistic way. And so that was really, really interesting. It helped us learn a lot about what this case competition is, how to approach global health fully, comprehensively, and it was our sort of stepping stone. 2021, we got second place at the competition, and that was really great. So we were focused on typhoon preparedness and risk management with a basically like a prevention, but also disaster management and mitigation program in Catanduanes in the Philippines. So that was also, and sorry, I just saw the question. So these were the titles of our presentations, but the prompts were basically what the titles are addressing. So for example, the second one was a prompt about preparing for typhoons in Catanduanes in the Philippines. Good question. Yeah, thank you for asking. And then in 2022, this year, we won at USC, and then we were able to do the international competition as well. And this year's was focused on vaccine hesitancy, distribution, and equity, specifically in Nigeria. So that was really, really interesting. And it was pretty cool to explore that in obviously like a time when vaccine hesitancy is a very real thing. So that was also super fun.
And next slide, please. So Mihir kind of touched on high level what the different topics were that we had the chance to explore, but we kind of wanted to talk about what the case competition meant to us in a nutshell. It really encouraged us to think globally, and I think also about very pressing problems. The picture that you can see on the right-hand side is our title slide from the 2022 presentation at USC. Our project was called Ready, Set, Go. And like Mihir was talking about, we addressed vaccine hesitancy and distribution inequity in Nigeria. And so when we were kind of given the case prompt, we really were able to dive into something that was happening on the ground. And we'll talk about this a bit later in our presentation, but it really allowed us to immerse ourselves in the problem in Nigeria by tackling something that was very real for a lot of people at that time. But even more than that, I think it gave us a lot of creative freedom to explore how we conducted this outreach and also how we presented something that we were able to put together after really trying to understand the problem. And so something as simple as you can see, like from the Ready, Set, Go logo that we ended up designing ourselves to, the way that other facets of our presentation were kind of set up, from 3D models to interviews to interactive videos, really gave us an outlet to kind of pull from the experiences of those who we were talking to in Nigeria, which included, musicians and artists and health professors, people from kind of all different walks of life. And so integrating that into our presentation style and also substantively the way that we addressed the issue was truly a privilege and something that we got to learn from.
Yeah, next, so we'll talk about how we found our team. So this picture is missing Nipun in our first year and Rohan in our last year. So just a kind of disclaimer. But there were 5 main things that we were thinking about when we formed our team. So just like past collaboration and familiarity were really important, just because we felt a lot more comfortable offering critiques to each other when we were coming up with solutions, when we were figuring out research directions and stuff like that. Just knowing how we work together and stuff like that was really, really helpful. So if you have friends that might be interested in working on this, I would definitely go to those friends first before maybe looking in other places, but other places are obviously totally fine too. Second, we looked for some academic and professional diversity. So we had some people, we had Nika, and she was in engineering. We had Mahima, she studied global medicine, Monastery public policy, and then I did econ and bio. And then in our freshman year, or in our first year, we had Nipun, and he worked on, he was like really interested in the finance end of things. He was a business major. And then this past year, we worked with Rohan, and Rohan is really great with film. He was a film major, so he was really great at trying to portray this whole story and put together our solution in a comprehensive but succinct way. The third thing, that we thought about a lot was availability, just because realistically, like it is during the semester, so there might be issues with like exams and stuff like that, or just overlap with other events. But that being said, like if you anticipate something maybe happening in the morning or in the evening, like it doesn't help to reach out to your professors to try to coordinate that. It also doesn't help, it doesn't hurt, to reach out to your professors to coordinate that. It also doesn't hurt to reach out to the case competition hosts and talk to them and see if they might be able to work something out. I feel like they were always super reasonable and like working and like accommodating us. So that was super great. 4 helpful past experiences. So by this, like I'm primarily mean just past similar experiences. So like if anyone's done a case competition already, obviously that's great. But also if anyone's done any sort of work in like just putting together solutions for a vast array of tasks, like that's totally fine too. Monastery, Mahima, Nika, and I all met through Rishi, where we were basically coming up with solutions for problems that are affecting rural India. And so that was something that really helped a lot within this. And then lastly, communication. Communication was super, super important, finding people that you can easily communicate with, but that you can also frequently communicate with is really, really helpful. Because during those 2 weeks of the competition, we talked a lot. We made sure that we were texting, messaging, and then meeting a lot as well. So just those communication skills were definitely key as well.
And then I'll go over this super briefly, but basically kind of what I was talking about before. At the beginning, when you get all of this context about what the problem is that you're seeking to solve or address, reaching out to different community and relevant stakeholders, like emailing people, cold messaging them on LinkedIn, really trying to talk to people who are on the ground experiencing the issue in order to understand what the problem is and not just relying on secondary research. The second is focusing on areas or solutions that you think are tangible and actually impactful in the way that you're addressing them, or listening to people who are on the ground and conveying their stories and figuring out how to incorporate those into your solutions. And the last is making sure you're developing something that's holistic and pragmatic. And as you explore the case competition more, you'll understand that there are measures of success and ways that you can actually figure out how effective your solution is going to be as you start to map it out. So a few tips and tricks for the case competition.
Okay, so also going to speed through this. We're running a bit low on time, I think, but competition day is a fun, super meaningful opportunity, I think, to develop your presentation skills. And you also get to interact with a ton of experts in the field, which is great too. Some really quick suggestions. So try to rehearse. And if you feel uncomfortable, or if you're struggling, consider a script. Make sure you practice questions, make sure you ask each other questions. That's always really helpful. And then presentation aesthetics do matter, just so you're conveying your message really clearly. And then the second thing is just that your narrative approach, a passionate delivery, and deep understanding of the issue, it matters a lot. It shows the judges that you care, and it shows how much you've researched the topic. So yeah.
And very last thing, there's a lot of things that you can do after you finish the case competition. The takeaways from it are so rich and so profound. The four of us that we showed a picture of before, we ended up turning all of our case competitions into research papers and submitting them to the Undergraduate Writers Conference, which we had an absolute blast doing. We applied to the Gates Global Grand Challenge with one of our solutions. All of us have kind of taken elements of the case competition into our careers. We joke that when we retire, we're going to continue to write papers and do things similar to what the case competition offered us, because it's truly a once in a lifetime experience. And I know something Mihir and I hold very close to our heart. So we really appreciate the opportunity to share it with you guys today, and are happy to answer any questions at the very end. Thank you.
Thank you both so much for sharing your experiences, for your commitment to the competition all 3 years, and coming back to share your tips and tricks with students. So next, I'm going to ask Justine Poe if you can please present about your experience.
Yes, so I am a second-year medical student at Keck. I just wanted to give you all a little bit of background, because I know that there might be many students here who are interested in applying for the Breman Fellowship in the upcoming cycle. So in terms of background, I actually went to UC Berkeley for undergrad, and I was really involved with this nonprofit called Partners in Health. And one of the photos there at the bottom is with Dr. Paul Farmer. He's someone who I've always looked up to for a really long time, for as long as I was familiar with Partners in Health. And so when he passed, obviously that was really devastating, even though I only knew him in passing. And then after I graduated, I worked at UCSF on kind of health policy research for a while. And then I did a summer fellowship with Cambridge. I was supposed to go in person, but with COVID, it was the perfect timing for me to not be able to do that. But it was still a great experience. And now that I am in medical school, still kind of continuing with research, mostly data analysis types of stuff. And when I did the Breman Fellowship this past summer, I was focusing on chronic disease management, which is really my passion at this point in global health. I think that's really where I see my career going, in terms of trying to focus on these diseases I think are still not very well represented or well understood by a lot of people in the field. So next slide, please. And I guess just a little bit of for fun stuff. So I really enjoy cycling, running, and basically any kind of endurance sport. So right before med school started, I biked across France, and that was 725 kilometers, so roughly 500 miles, a little bit under that. And after this week, I'm actually going to be biking across Japan, so you can see the route from north to south. So that's going to be really exciting. Next slide, please. So this is the fellowship site where I was actually at for the month of July. And it's the African Population and Health Research Center, a really great established research partner with USC that I know that a lot of the professors at IIGH work with. And they're headquartered in Nairobi, Kenya. And specifically for my project, I was in the Health and Systems for Health division and in the Chronic Disease Management division. So I'll talk a little bit about kind of how I got familiarize with APHRC, because I think that's something that a lot of people can struggle with because they don't really know even where to start, or what organizations to reach out to. So I was originally, and I'm still involved with the Student Advisory Council at IIGH. And so it was through that I was talking to professors and kind of asking them for their recommendations in terms of where I might look and reach out to. And it just so happened that APHRC had this really great partnership. And for me, I'm actually particularly interested in oncology. So they had a new project with like on cancer research, which is very, very new. And I'll talk a little bit about how that project ended up changing over the course of like when I arrived in Kenya and all of that. But yeah, so next slide, please. So the actual internship project that I ended up doing was around kind of the disruptions that were caused by the COVID-19 pandemic, and specifically on patients and providers of type 2 diabetes care. So the way that this happened is the oncology project that I was originally going to pursue and that I actually applied through like and put a proposal and all that, just had not received IRB approval. And so this is just something to keep in mind, that it's something very common, like even like beyond just like for students, like anyone in the research sphere, like there's always going to be delays with funding and getting approval and all of that stuff. So just be ready and be kind of like flexible in terms of still making the most of your experience. And I will say, like, just at the head of it, that it was a very good experience. And the two kind of like parts to this project, for me, were really addressing financial toxicity, which is, I guess, kind of like a very academic term, basically trying to say that there are ramifications to the cost of healthcare for people with chronic diseases who are in like consistent need of medications or follow-up appointments and treatments, and those costs add up, and then they impact your health in other ways because of that economic cost. And this was part of a larger study that was being done called the GECKO study, which is the global effort on COVID-19. Next slide, please. So a little bit about the study design for GECKO. First was qualitative in-depth interviews, and so these were done with patients as well as providers from 4 different Kenyan counties, and these were distributed amongst urban and rural counties so that we could get a good spread. And this was done already by like other researchers in the larger team. And so my job, along with another students, was to actually codify the key themes from these transcripts, and having 2 different independent reviewers, obviously, so that way we can make sure that the themes are like minimizing bias. And there's also a quantitative component where they collected data on changes in income, changes in quality of life, and very detailed information on healthcare expenditure as well as utilization. And so that was a separate project that like we didn't focus on as much, but still interesting. Okay, 2 minutes. All right, next slide, please. And a couple learnings I thought were really interesting in terms of how APHRC does things that was unique in terms of like what I've seen from other research institutes. I thought it was really nice that they involve stakeholders early. So they have meetings with policymakers and they have dedicated staff to talk to them about, oh, this is a project that we're doing, so that there's kind of less of a shell shock when the final project comes out, and there's a more likely to be buy-in. And also just involving actually like community stakeholders as well as media representatives. Next slide, please. And then in terms of the actual findings from my component of the study, I would say that these are things that it makes sense when you just think about it. So COVID-19 really exacerbated the challenges in accessing treatment and in accessing medications that were kind of already like had weak infrastructure. So a lot of patients mentioned things like the inflation and really losing jobs, losing income was a really big problem for them, and also led them to have to relocate to more rural areas where they had family, which made it more difficult to access appointments. And I'll just leave it at that. Next slide. And in terms of health impacts, there's actually noted an increase in hyperglycemic emergency. So that's one of the most concerning complications if you are someone with type 2 diabetes. And this is something that we were seeing because people were not really able to afford, one, their medications, and two, to maintain their diabetic diet that would keep their glucose at a proper level. And I'll move on to the next slide. Okay, so I think this is maybe the most important slide for you all. So just a little bit of advice, I would say. I think more than anything, before you try to go abroad, I feel like it's really important to build transferable skills at your university. And I think we're very lucky at USC that there are a lot of opportunities to do so. And there are a lot of professors who are very willing to like bring students under their wing. So data analysis, I think, has been really particularly helpful for me because it's transferable kind of like across many different projects, but also like qualitative research, like we kind of, learned about earlier on in this session, is also very helpful. So I would say dive deep into the opportunities that are offered that you're learning about in this session. And I would also say to narrow down your research interests, because global health is such a huge field. That was something I really struggled with at the beginning when I was talking to Dr. Greska and just saying like, I'll do anything. Like, I just want to like, I'm just here to help and all this stuff, but like, you really need to narrow it down. And also to be clear about like what you need and what you're looking for so that you can end up on a project that is exciting to you. All right, thank you very much.
Thanks so much, Justine. That was really exciting to hear about. Next, I'm going to turn it over to Abigail. If you can please share your presentation.
Alrighty, hi. Yes, I get to close us all off. So my name's Abby. I am currently pursuing my Master of Public Health at Keck. I finished my undergrad just in May, so with a few other people. And I was a Breman Fellow this past summer. I got to go to Uganda and I was working on a research project looking at nutrition. So I'll tell you a little bit more about it. Next slide, please. Alrighty, so actually towards the end of 2020, I got involved with a professor on a project that she and community partners were launching, training about 30 youth ambassadors as, or 30 youth as public health ambassadors. So these are around secondary school, so high school age youth. A lot of them kind of were home during lockdown. And so our community partners kind of galvanized the youth and set up a lot of workshops to train them in what is public health and what does it look like to be advocates in the community for different public health issues. And then also we got to train them on how to collect data, how to disseminate findings. And so these different skills, I think for the last couple of years, we've been working with the youth. And of course, because of COVID and just the nature of distance, we were doing a lot of things on Zoom. So that's us on Zoom. And then this is our community partner director, Kenneth, and he was really kind of the one spearheading everything in Uganda, along with our other partners. And then here are 5 of our youth ambassadors pictured for the study. So next slide, please. Alrighty, so our youth, they in the last year conducted a pretty big community health assessment, just gathering data on a lot of different things, including malaria, access to malaria mosquito nets, or water and sanitation. So a lot of different areas. And I think as we were reviewing this data, Kenneth and I, we saw that nutrition was something that was kind of standing out. So they didn't have, households weren't reporting a lot of access to diverse diets and multiple meals in a day. And so that was something we wanted to explore further. But I think nutrition is hard. I think when you get to the quantitative level, you need trained health professionals to be able to gather a lot of specific measurements. And so we wanted to go the qualitative route and really using focus groups and interviews to understand what the community really believes is being done about nutrition. So I think they all have a sense that nutrition is an issue, but we wanted to see what their perceptions on current interventions being done and to kind of compare that to national strategies and framework. So essentially, is what the government's saying they're doing, is that actually happening, and do communities believe that's happening? So we had several, we had a timeline. Oh, you're good. So we basically were between April and June, developing a lot of protocol, our survey tools, or our interview guides, and doing a lot of IRB approval work. It's pretty intensive. And then I was actually in Uganda from July to August, doing data collection and different community engagement. And then right now I am doing data analysis and trying to kind of pull together our findings. So next slide, please. Yeah, so these are a few pictures kind of on our focus groups and interviews. So our ambassadors, it was actually incredible to be able to meet them in person finally after a while seeing them on Zoom. It totally changes when you're actually with them in person, because I think everyone's a bit shy on camera and Zoom. But so we got to basically have a training session with them about what the study is and about nutrition. And then they were part of all of our focus groups. They helped to kind of do a little teaching session after each focus group on best nutrition, best maybe diet choices and things with our community members. And so so for our interviews, we actually got to interview stakeholders kind of at the top government level, so people in Ministry of Health and other overarching entities, and then also at the district level, got to meet up with nutritionists and other people, community leaders. So we really got a pretty wide range of perspectives, and I think it was super neat for me because I just wouldn't have ever talked to these people or met these people otherwise. So it was a great opportunity. And next slide, please. And then another portion of our work was we're actually going, and on that community health assessment I mentioned earlier, there were a lot of findings that we wanted to share, and the youth have already been sharing them, even when we're not there. But we got to go, and while we were there, have meetings with Parliament, present to the Makerere University School of Public Health, and speak to the Ministry of Health. And we made little fact sheets, and we got to carry them and kind of distribute them and just talk about what's happening in northern Uganda. And I think probably the biggest takeaway for me, I think on one end you see how these meetings might not have so much long-term impact because these policymakers have lots of meetings they're going to all the time. But really the biggest impact for me that I saw was seeing these youth ambassadors. We brought about 5 of them, 5 out of the 30 from northern Uganda to Kampala, the capital, and seeing them stand up and just present their findings was pretty cool. I think there was one moment where one of the ambassadors, he just stood up. It wasn't even his turn to speak, but he just stood up and he said, the data shows that we don't have water and we need water. So you guys, or y'all are in power, please make that happen for us. And I thought that was just a really, really neat moment of empowerment and inspiration. So next slide, please. And then I had a lot of fun too. I think I don't know, being able to travel and meet all these new people was incredible. It's a beautiful, beautiful place. Lots of actually really great food. And so I don't know, in the top middle, if you can see, so we kind of randomly were able to be on a TV segment for the Makerere School of Public Health. They have, I guess, a channel once a week, a health show. And so they featured us in our work. And then in the bottom middle, some of our friends who we were working with also do music, and they just wanted me to record a song with them. So I recorded a song with them. And then on the bottom right is my teammate and I, we spent the 5 weeks together. She loves Korean dramas, Korean culture. And so I got to go with her and take her to a Korean restaurant that I found in Kampala. So lots of fun. And I guess I don't want to go over too much on time, but just kind of ending here, I wanted to share a little bit about the lessons that I learned in the different challenges. So I think Justine definitely touched on this, but I think I've learned to really start planning early and really being on top of IRB proposals and submissions, all these things. I think part of it is being flexible, but also just recognizing that it's a really long process. So I had to do IRB approval at USC, but also at an institution, university in Uganda. then they also have another approval system for just their national council. And so there's a lot of different steps that you have to kind of keep going through, and a lot of back and forth to fix things. So yeah, just planning ahead and being diligent about that. And then secondly, just being flexible and open with a lot of these just the day-to-day life on the ground. I think whether it's community events that take place, or even phones and devices like breaking down when not being able to use it for interviews and things like that, just being okay with it, I think, and being able to laugh off a lot of things. That's a good skill to have wherever you are. And then finally, definitely the biggest success or biggest reason for the success of this project was having a lot of partners who I'd been working with for not a long time, but a considerable period of time. And they were the ones who I stayed with, who helped arrange all these like meetings and were there with me kind of developing this whole project. And so I think that was really key, and identifying those people who you can work with, learn from, is really important. So yeah, thank you.
Great, thank you so much, Abby. I want to thank all of the presenters today. Thank you for sharing about your experiences. As a quick recap, IIGH offers plenty of education opportunities. So if you're interested in global health, please reach out to us. You heard from your colleagues today about their participation in research projects and the case competition, in the fellowships that we offer, Student Advisory Council, and more. So thank you for your interest. I do want to open up to questions. I realize we're at a minute left, so I apologize that we're a little bit short on questions, but feel free to type them in the chat now, or to follow up with us or your colleagues via email. If you want to ask somebody a particular question and you don't have that email, please feel free to email us at IIGH and we can forward it on. I'll go ahead and close the meeting. Thank you, everybody, and we look forward to hearing from you in the future, both our students, our alums, and our current students who may be interested.